I'm Luc Schuster, Policy Analyst with the Massachusetts Budget and Policy Center. This video offers major findings from our recent Cutting Class report, which is available online at massbudget.org. Cutting Class compares the foundation budget allocation across all of the major education spending categories with what districts in Massachusetts are actually spending on those areas. The foundation budget is the state's program for identifying an adequate baseline spending level for each individual district in the Commonwealth, and it recognizes different costs for students of different types. For example, districts with a greater proportion of low-income students recognized to have higher costs and get an additional dollar increment in the foundation budget calculation. The major finding from this report is that the foundation budget has done a poor job of capturing dramatic cost growth in the areas of employee health insurance and special education. And the effect of this has been, for many districts, to reduce spending on core education spending categories. Most importantly, we see almost all districts in Massachusetts spending well below the foundation budget assumption on regular education teachers. So first, let's look at the foundation budget assumptions statewide across each of the major education spending categories. We show this bar graph just to give you a sense of what the major education spending categories are. You'll see regular education teachers is by far the largest category, which makes sense since most of what we do in schools is hire teachers to run our classrooms and educate students. So let's compare the foundation budget assumption, the light blue bars, to what districts are actually spending on these areas, the dark blue bars. There's obviously a lot going on in this graph, so let's focus in on the three areas where the foundation budget most understates what districts are actually spending: employee health insurance, special education teachers, and special education out-of-district costs. And on the one area where districts are most underspending the foundation budget assumption, regular education teachers. This next graph will hone in on total statewide spending on employee health insurance and the two core special education costs, and we'll compare the foundation budget assumption to what districts are actually spending. In terms of total dollar amounts statewide, the foundation budget understates district health insurance spending by about $1.1 billion. Similarly, special education in-district costs are understated by the foundation budget by about $665 million, and special education out-of-district costs, the cost to districts of paying private tuition payments for high-needs special ed students, the foundation budget understates those costs by about $356 million. Taken all together, we observe a gap of $2.1 billion for fiscal year 2010. Health insurance and special education costs have risen dramatically over the last several years, and without making adjustments to the foundation budget calculation to better capture those true cost increases, the foundation budget has lagged significantly behind actual district costs. In particular, healthcare inflation has grown at 2 to 3 times the rate of the inflation factor written into the Chapter 70 law. The formula simply has not captured the dramatic increases to healthcare costs nationwide. The recent municipal health reform law passed by the legislature last year will likely help close some of this gap, but even the most optimistic estimates project savings that would only marginally help in closing the $1.1 billion gap that we see here. Similarly, special education costs have risen dramatically over the last 2 decades, with many more children born severely premature surviving childbirth and then having to be serviced through our public school system. Again, without adjusting the original foundation budget assumptions for special education, we have not reflected the very real changes in this area over the last couple of decades. Now let's look at the effect of the foundation budget understating actual district health insurance and special education costs on their regular education teacher spending. For this analysis, we're going to first just look at the highest wealth districts in Massachusetts. And what we've done here is break out districts into wealth quintiles. So in this case, we'll just be looking at the districts in Massachusetts that are in the top 20% of wealth. For health insurance and special education costs, we see the same significant gap as shown previously. But interestingly, these wealthy districts are still able to spend at foundation levels, in fact a little bit above, on regular education teachers. How do they do this? Well, they do it by raising additional local revenue so that spending above foundation in some areas doesn't force them to reduce spending in another. Next, let's look at spending on these same three categories again, but in this case for the least wealthy 20% of districts in Massachusetts. So here we see roughly the same gaps for health insurance and special education, the pair of bars in the middle and on the right, but for low wealth districts these gaps are accompanied by significant underspending on regular education teachers, the pair of bars on the left. On the whole, most of these districts are spending right at the total foundation budget minimum, so for them, having the foundation budget assumption understate their costs in these two areas forces them to make cuts elsewhere. Unfortunately, regular education teacher spending is the largest spending category in their budgets, and so much of the reductions are made here. Sadly, this is where spending most directly affects the supports we are providing for kids. Finally, let's focus in on spending on regular education teachers and do this comparison again by wealth. Here we'll break out all 5 different wealth quintiles. Here we see that while every type of district is spending well above the foundation budget assumptions for health insurance and special education, almost all districts are spending below foundation on regular education teachers. Again, teacher spending is the core input for schools, and we're seeing all but the very wealthiest districts underspending the original program levels outlined in the Education Reform Act of 1993. So, let's review the major findings of this research. First, we see that low wealth districts, for the most part, spend right at their baseline foundation budget amounts. Second, we see that high wealth districts, by contrast, often spend significantly above their foundation budget minimums. We see that the foundation budget understates core special education costs by about $1 billion. Foundation budget also understates core employee health insurance costs by about $1.1 billion. This, for most districts in Massachusetts, has resulted in significant underspending on regular education teachers. And finally, it's our sense that districts have not implemented the low-income student program originally envisioned in the Education Reform Act of 1993. I'd like to wrap up by mentioning that we've created an online interactive tool that supplements the written report on our website, MassBudget.org. Using the simple features in this tool, you can see many of the foundation to actual spending comparisons that we discuss across the wealth categories and by individual school district. Again, you can find the full cutting class report on our website, MassBudget.org. If you go there, you'll see much greater detail on the methodology we used, sources for our data, and some additional findings that aren't included in this video. I hope you found this useful. Thanks so much.